This week's Ask Dr. Durie is about the role of autologous stem cell transplant. And this patient asks, what should I do? I've taken Cyborg-D for 5 months and I've achieved about a partial response. Is it still okay to go ahead with an autologous stem cell transplant? Well, the simple answer is yes, it is okay. And why is that? Well, what we have learned over time is that the response with the initial therapy, in this case Cyborg-D, does not predict what will be the benefit with the high-dose melphalan and the transplant. And so there is a standard protocol to use the induction therapy like Cyborg-D for 4 to 6 months and then proceed with the transplant even if only a partial response has been achieved. And the reason for this is that myeloma is typically a rather slow-moving disease. And so when it's growing, it can grow slowly, but also when it's responding, it can respond more slowly. And so the best response for a patient with myeloma may not be within those first 4 to 5 months. It may not even be after they have gone through with the transplant. It may be after they've had consolidation after that, or maybe even after 1 to 2 years of maintenance. And so that best response can be significantly delayed. And so don't be depressed or overly anxious if with this first step, which is the early therapy in preparation for the transplant, has not produced that best response that you're looking for. You can still do fantastically well, and it is important to stick with the plan, to stick with the protocol, and move forward with that transplant. Now, one question that comes up is, if the marrow is not cleared of the myeloma, will the stem cells be contaminated, and will those stem cells that I get back be a problem and be a source of relapse? Well, the good news on that is that the myeloma does not relapse coming from the stem cells which are given back. The main source of relapse is myeloma which is left in your body. So don't worry about contamination of the stem cells. The stem cells are mostly clear, and if there would be an occasional myeloma cell in those stem cells, those do not grow when they're given back. They are very sensitive to the freezing and thawing process as part of the stem cell administration. So bottom line, even if you've just had a partial remission, it's good to go ahead with the protocol and go ahead with that planned autologous stem cell transplant.